What are some of the most Googled Medicare questions? We have helped thousands of people with their Medicare, and we wanted to see what people are questioning the most online. So we used a website called The Public to see what the most searched Medicare questions are, and we will give you answers as well. Let's dive into it. One of the biggest questions we saw on this website is, are Medicare premiums tax deductible? Well, Medicare premiums are tax deductible, but there is a catch. For you to receive any tax deduction for a medical bill, be it a premium, deductible, copay, or anything like that, your medical expenses must exceed 7.5% of your AGI or adjusted gross income. This means that if you have an income of $100,000, every qualifying medical expense past $7,500, aka 7.5% of your AGI, is tax deductible. If you're self-employed, you can use any Medicare premiums as an above-the-line deduction as well. Now, while this is an overview, we highly recommend you talk to your accountant about any medical-related tax questions. We do have a lot of insight on the subject, but we always say go to the source, go to the expert. The second question we saw is, what does Medicare cover? Medicare at its base covers hospital, which is known as Part A, and medical, which is known as Part B. This is what is known as Original Medicare. Original Medicare has a robust network of doctors and hospitals and has very little provider friction, meaning it's relatively easy to get the medical work you need done. Now, while this coverage is great, there can be some very high deductibles and co-insurance costs on Medicare by itself, so most people purchase something called a Medicare supplement to help lower or eliminate those costs. Original Medicare does not cover prescriptions, dental, vision, and hearing. You will need to purchase additional policies to cover all these things, or in many cases, you could get something called a Medicare Advantage plan that will give you coverage for those extra benefits like dental and prescription. Now, whether you take a Medicare Advantage plan is a subject for another video. There are definite pros and cons, and if you want to dive in further, check out our other video on the subject, which I'll put up here. Is Medicare Advantage the best or the worst? The third question we saw constantly is, when does Medicare start? This varies highly depending on the individual, but let's talk about the three most common situations. The first situation is you are turning 65. When you turn 65, you can start taking Medicare the first of the month of your 65th birthday. If you're already receiving Social Security benefit payments, you will automatically be enrolled in Medicare Parts A and B, and your card will come automatically in the mail. If you're not on Social Security, you will have to enroll proactively. If you're still working and want to keep your insurance, you can delay Medicare Part B and keep your work insurance as primary if you work for a company with more than 20 employees. When you do want to leave your work insurance, you can apply for Part B and make Medicare your primary prior to or within 8 months of leaving employer coverage. Note, COBRA doesn't count as employer insurance for this rule. The final situation is if you have been on Social Security disability for 24 consecutive months. At this point, you will automatically be enrolled in Medicare even if you were under the age of 65. You may also get Medicare disability under 65 much quicker if you have certain conditions such as ESRD or ALS. The fourth question we saw is, what Medicare plans cover prescriptions? And this is actually a pretty easy one. When you become Medicare eligible, you can keep Original Medicare and get a standalone Medicare Part D plan. These plans tend to have relatively low monthly premiums, and depending on your setting prescriptions, could have low copays as well. The other option is to get a Medicare Advantage plan with Part D coverage included. Now, this will take a lot more thought because if you take a Medicare Advantage plan for Part D coverage, you do alter your access to Original Medicare. Deciding what's best for your prescriptions is a great conversation to have with a licensed broker to see what is the best fit for you. Now, these were just 4 of the most common Medicare questions we see online, thanks to the website thepublic.com. If you have any more questions, and we know you do, feel free to reach out to us at any time at www.njlifeandhealth.com or call 848-226-6897, which is our Toms River, New Jersey office. I always joke, don't let the NJ and NJ Life and Health fool you, because we are licensed in about 20 other states, and chances are we could help you out as well. And if you're someone who just wants to learn on your own pace, we have a ton of great educational content that you can check out on our YouTube channel. So comment, subscribe, and if you have any other videos or questions you'd like covered in a video, just leave us a comment, send us a DM, and we'd be happy to do it for you. So, thanks again, and we'll see you in the next video.